two of the gold standards for the treatment of opioid use disorder that we've been using for several decades are medications methadone and buprenorphine, also known as Suboxone.
Researchers wanted to find the answer to the lingering question: how do the two medications perform against one another?
The reason why we're so focused on retention and treatment is we recognize that opioid use disorder is a condition that generally requires long-term management.
The study has been published in the Journal of the American Medical Association by scientists and public health professionals from Canada, the US, Austria, and the UK. It looked at data from over a 10-year period with more than 30,000 people in BC being put on these two medications, and more than 60% of them prescribed methadone. Researchers found both medications reduced the risk of overdose, but methadone did a better job at keeping people in opioid agonist treatment.
It's a liquid that you have to present at the pharmacy every day and drink while there, and it does help manage cravings and help give people some stability in their life and kind of some opportunity to take a breath and potentially engage in other treatment-related activities.
This drug policy advocate credits methadone for saving his life, but says easier access to the medication is needed.
You have to go to the pharmacy every morning, or most people do. And so if you have a job, if you have to go, to another province to see a relative, it's very difficult. That's why people call it liquid handcuffs. So loosening some of those rules would be very helpful.
Mullins says he's been on methadone treatments for 2 decades.
There's not going to be any kind of wild contaminants in it. That's the key to methadone's success. And that's the same idea as safe supply, is just finding replacement opioids that aren't going to cause that fatal overdose.
Dr. Box says both methadone and Suboxone have different benefits, and findings from this study will help further inform doctors who can work with patients to prescribe the best treatment. Michelle Morton, CBC News, Vancouver.